I thought about the physical therapy field way back in high school when I first had a knee injury, had to have knee surgery, go through the physical therapy process myself, but I never really pursued it further than that. And then I started reading about the PTA program here at Delta, liked everything I was reading, so I went ahead, signed up, put myself on the wait list, thought let's just see where this goes. And then while I was on the wait list, I sustained another knee injury. But my second time through, as soon as I made that leap from getting off the crutches into actually walking normally again, I think is when it hit me like, okay, this is what I want to do. This is what I want to help people overcome.
There's nothing more rewarding than taking somebody and working with them as a team. They can't walk when you start, and then 2-3 weeks later, they're up walking around, maybe even going home from a rehab center to outpatient therapy. We are the preeminent experts of the human body and movement of the human body. So that makes us very unique in that regard. The physical therapist is responsible for the patient, and the physical therapist assistant is working under that therapist. The PTA can do all the treatments, can come up with different treatment plans, can run it by the PT. Being a physical therapist or physical therapist assistant at HealthSource, you have to be very versatile. You have to be able to flip your switch basically from one type of therapy to another, meaning inpatient to outpatient, maybe back to back. I can count on one hand the amount of days that I've went to work going, oh, I don't want to go. And that's the truth. I walk in here going, this is gonna be fun today.
Our hands-on classes here, we have a really good breadth and depth of our different content areas. So we have specific topics classes just in pediatrics, just in manual therapy, just in things like amputees, geriatrics.
What I really like about the program is that each class comes with a lecture and a lab. So everything you're learning in lecture, you're taking those skills and actually applying them hands-on to one another in the lab classes.
All of our faculty are licensed PTs and PTAs in the state of Michigan. Many of our faculty are full-time clinicians, and they teach sort of on the side. We do have full-time faculty here as well, but many of us in the full-time faculty still do work on the side. And so myself, for example, I still actually work 2 side clinical jobs, both in a hospital and in a school system.
The best professors, they are clinicians also. They know the real life stuff. They're not teaching out of a book. They're teaching real life stuff.
I love coming to class and saying, this weekend I worked with a patient and this happened, and this is what I did, and here's why. And students just, they're all ears. They just absolutely love that. We have a variety of clinical education opportunities, and we offer our students 4 different experiences of clinical education, and they get a say in picking what kind of experience they want to do. And what that means is they get to go to a place where patients come, or maybe patients live. There are licensed physical therapists and physical therapist assistants there who would be providing the care typically. And when the student comes, the student gets to provide the care under the supervision of the PTA or PT.
In school, you're dealing with normally healthy individuals because you're working with a lab partner. You come into this clinical rotation and you are dealing with pathology now. And these folks are not faking or acting like they're injured, they are injured. So I think that is probably the most beneficial aspect of being a student clinician.
But one thing that students really have to be is flexible. I mean, in any setting, in any part of physical therapy, because you might have 2 patients come at one time. You might have a patient come late or early, or maybe a coworker is going to call in sick and you have to take on their caseload.
We're looking for very flexible people here at HealthSource. We're looking for folks that can adapt, especially folks that can handle difficult patients. If you want to be in this field, you have to be able to deal with people and talk to people and communicate with them. So the best time to start practicing is as a young person. Talk to older people, because believe it or not, 75% of our clientele will be older than you when you work. And that's because they're the ones breaking legs, having surgeries, being hospitalized.
One of the most unique and maybe most recognized way that PTAs can further their education after they graduate is through the American Physical Therapy Association. They offer what's called advanced proficiency for the PTA. And essentially what that means is they recognize PTAs who are experts in their field, who have done extra education in that certain niche that they might be treating in every day, and then they take an exam, an assessment, take some additional coursework through the APTA, and they get this recognition that's recognized nationally.
In some of the contract companies, PTAs are actually the boss of the clinic. They're the directors of the clinic. So there's been a lot of doors opening for the PTAs.
If there is a way for me to move up and have an administration role, that would be great, which is one of the reasons why I've thought about going back for my master's in health administration.
Other options that PTAs could do is go back to school and get a bachelor's degree. That could help them further their career within their organization, maybe move to a management role or a supervisory role.
What I like to see is the student that has put some time into this, because this isn't for everybody, and we want you to find the right career, whether it be a plumbing or electrical or physical therapist assistant or PT. We want you to actually explore the options, and the earlier the better.
Go ask if you could do some observation hours somewhere, talk to some PTAs, email students. You know, myself and my other classmates are very eager to help up-and-coming students answer any questions that they may have.
I cannot even describe how amazing it is to have the knowledge and the skills to be able to look at someone and know what to do to make them feel better, move better, and just all around have a better quality of life. And physical therapists, assistants, and PTs have those skills.